Hello everybody. Welcome. Thank you so much for joining us on this lovely Thursday for our live stream. So we are here today to talk to you about repairing injuries and returning to sport throughout a lockdown and how that is different to a normal return to sport. So I'm joined today by Arthur Ebel and Zoltan ZAVODY, who are going to tell you a little bit more about themselves. I'm Joanna Rennie, Director of Truth Pie and Clinical Aromatherapist. And over to you, Arthur, introduce yourself.
Hi everyone, I'm Arthur Ebel. I am a personal trainer and an ice skating coach, and I've been a PT for about 3 years now, and an ice skating coach for about 1 year, and I've been ice skating for about 29 years now.
Nice. Zoltan?
Hi everyone, Zoltan. I'm a soft tissue therapist, which is a posh name for clinical massage therapist, and I specialize in helping musicians who are in long-term pain, chronic discomfort from all that playing and practicing that they do, and also other precision activities where you really want to get your muscles and your body in just the right position.
Perfect, thank you. So we've got two gents here with a lot of experience working with athletes, working with people who play a lot of sport, go to the gym a lot of the time. So if that's you, this is the perfect time for you to listen up, hear how the last year may have affected you in ways you know about, ways you don't know about, how you can recover from injuries, and how you can possibly better prepare yourself for next time in the coming months. So over to our name of the game, as it were. We are at Truth Pie focusing on repair, restore, refocus this month in all areas of well-being. So to start off for this chat, so what do we mean by repair, guys? What sort of injuries have you found have been most common for sports people? What has been going on for regular gym goers throughout the last year? And what do they need to be doing in terms of repairing their bodies from that, or minds, whatever?
Shall I kick off on this?
Yeah, go for it, Zoltan.
Yeah. So interestingly, there's two big classes of issues we're coming across at the moment. One is people hunched over their desks at the laptop at the kitchen table or wherever, and that's lower back pain and neck pain. But then the other class is people who are trying to do a bit of sport after months of sitting around, or even trying to get back to sport in the way they used to play without having had the training and the practice. So typically the injuries we're seeing there are ankles, knees, and shoulders.
Yeah.
Those are the most dominant at the moment.
Okay.
I don't know.
And what are you doing in terms of sort of helping your clients repair, at the moment from those sort of injuries you're seeing?
Yeah, it's every injury is slightly different. So I always hold a video consultation with somebody first, just to see if I can help them, or if I need to refer them on to someone else, maybe to Arthur. So that's the first thing, is just to see what's going on with someone, and obviously then we can take it from there. On a video call, what we found, and as a manual therapy industry, what we found is that there's so much that happens outside the therapy room, if you like. So imagine this: you have an injury, you book an appointment with the doctor, with your manual therapist, whoever it is. Already you're gearing up to have some attention and to get better. Then you go and you discuss with someone what that injury is. You're getting advice. You're getting some self-help advice as well. So twisted ankle, there'll be some acute injury treatment, and then some longer-term injury rehab treatment. So a whole range of things we can do on video calls. And then Arthur, I don't know if you want to add to that.
Yeah, I was just going to add to that. When you mentioned lower back pain and shoulders and everything, the thing that I've seen over the last year is that because of like repeated lockdowns and the gyms being closed, and people don't have certain equipment, is that people like exercised and then stopped, and then exercised and then stopped, and then so by doing that, so the body gets used to something and then it stops, and then it sort of doesn't have any time to like develop anything serious, so it's always like restarting. And then sometimes when you restart, you feel that you haven't left off like too long ago, so you want to pick up where you left off, and but you really haven't done anything in the middle. So we're really just gonna have a look at what you've been doing. Has there been any weight gain? Has there been loss of motivation? Any sort of not injuries, but little things that trouble you, the shoulders, back, knees, anything that you haven't used during this time off. So yeah, we're going to be looking at that at the beginning. Yeah.
Cool. So there's lots that you can be doing even while you're online. You're not just it's not something that's limited to face-to-face. You actually are finding that you're able to benefit your clients while you're working on video calls. That's really great.
Yeah.
Okay, amazing. So now if we are looking over to restore as sort of a next stage in this process, if everyone's sort of feeling repaired from the year, and I imagine that there's still extra steps that they need to take before they actually start to prepare and be ready for their full game. We're talking about people that have been really quite regular athletes, regular gym goers, and regular sports players. And so actually to go from like, okay, I've just repaired myself, to sort of a normal person, I mean, to a normal place, it's a starting point, isn't it? So what do you think might have changed for them the most that they might need to be working on at that point?
Should I start with that one, Zoltan?
Yeah.
Great. Well, what I've noticed, and working with you, Joanna, when I train you, is that
Arthur is my trainer for everybody.
Yes.
Yeah,
we're staying in the family. Is that people at the beginning will need motivation, and even though like Joanna, you were a professional dancer, like you have it in you, you've done it your entire life, and I feel it myself as well. When I don't exercise for a period of time, I know that it is very hard to get back into it. And just the simple fact of, I would say, like hiring a PT. I've had to hire PTs myself before because I just couldn't be arsed. It really just brings you back into the game, and you don't need it for like a full year. Sometimes you just need it for a certain amount of time just to get you going again. And then once you're in, you're like, I got this, so I can keep going.
Okay, so it's like a mindset. It's like a mindset shift. I mean, I definitely found that when I was working with Arthur's like able to jump in and be, at the time when you're just about to give up that movement that that you're capable of. You've done it before. I used to be an aerialist. I used to be able to do however many pull-ups and push-ups that I can't do now. But he also is that person that doesn't make me feel bad that I don't have that same strength that maybe I used to, and really makes me feel like I'm going to have that strength again. And that's the difference between doing that on my own, where I may have gone, this is really quite painful now, and I feel like I've worked out. But he goes, one more, extra push to go, no, let's do this to like let's really push you and see where your body can go. And it's quite exciting to work with a PT in that way.
It's really easy for people to just go, I can't do this, and well, that's one of my goals, but I won't be able to achieve it. Whereas when I'm here, I'll be like, well, you will achieve it, but you won't do it today. So like what you've accomplished today is bringing you one step closer, and then one step closer, and then before you even know it, and because also I have an outside look on what you're doing, I can be like, well, adjust this, do this differently, and then before you even know it, will get there. But it's very hard to like process it yourself on your own.
Yeah, to visualize it. Zoltan, do you have anything to add there?
I absolutely agreed there. So it's all about the individual as well, isn't it? And their approach and their attitude. So every client is slightly different. And, you know, I sometimes have a client who comes in and says, I just want you to fix this, you know, just fix this in one session. Yeah. And there's a quote by, it's in a Chris Christopherson's song, actually, country singer. It says, of a boxer, the first thing to go is your reflexes. Then it's your legs. Then it's your friends. So an injury, you know, after a sustained period of not training, it's more than just the little fix that might be, you know, in a joint somewhere. There's the reasons for why it's happened. Maybe your reflexes had become a bit foggy over the months. And then there's the social aspect of it as well. So are you still managing to have the psychological kind of support that Arthur was talking about in terms of training, in terms of the social kind of cohesion of being in a team, of doing what you do?
And I guess, yeah, finding other ways to find a social aspect, you know, which can be joining a community, it can be having conversations with people, you know, online, wherever you can, or socially distanced where you're allowed. And it can also be finding other ways to look after yourself socially, whether that is sort of finding a way to have relaxation sort of therapy or anything like that gives you the same joy, maybe, or it's not going to be the same as socializing in a team, but it's going to give you something to look forward to in a similar way, I guess.
Yeah.
Okay, cool. So that's really interesting to sort of think about the mindset before you then go to push yourself that little bit harder. So now we're looking at refocusing. So we're looking at refocusing for a return. We're looking to actually get back to maybe where you were before, maybe where you're now going to go with what your new goals are. What's the best way someone can prepare themselves, set themselves up for success when they're returning to a sport?
Do you want to start with Zoltan?
Yeah. Okay. Well, building. So this whole process of repair, restore, refocus is it's fluid, isn't it? And even it's cyclical as well. So you make some improvement, and then you go back to restoring something else, and you build like a snowball, rolling, becoming bigger and bigger as a person. And key things for me, I think I mentioned reflexes before. So exercises that train your joints and your body to respond more quickly to whatever's going on. So proprioceptive exercises. If you're looking at your ankle rolls in different degrees, not just boring but interesting ways of rolling your ankle in a safe way. Try wobble board if you have one. Similar with your shoulder. Are you doing shoulder circles? Are you making wide circles with your arms? Or are you immediately going to lift a 30-kilogram weight? What's that going to do? So that kind of re-educating your joints and your muscles, reminding them of what they can do, what's safe to do, and then what's the limit of what they can do at the moment. That would be a key part of what I would suggest.
And Zoltan actually has some really good videos on his Instagram for certain of those exercises. I've seen them come up. I'm sure that they're still there. They're still around.
Yes, Gloria. Yes. Thank you for seeing.
They're very good. And they're, if you want some ideas, even just to start you off, you are sports people who are watching this, right? You are people who know your bodies. if you are feeling like, you know, you've got something going on in your shoulder, you've got something going on in your ankle, go and have a look on Zoltan's page, go and have a look on Arthur's page as well. But they both have really good videos for things like that. Zoltan has really good ones for sort of self-massage and stuff that you can do as a sports person to be able to actually look after yourself, and then you can develop that. You know your body, you know how you can develop those. You've done exercises before, so you could try and build on those as well. So what,
Arthur, so can I just perhaps come in that one of the key things that you know, probably isn't a surprise to anybody is that people who have been doing a lot of sports before but then backed off during lockdown, they often expect and to be at the same level, and are frustrated because it is frustrating when you're not performing as well as you used to. And so they try to take shortcuts, and that's when, in my experience, the injuries happen. Yeah,
indeed. Being at a certain level and using your body like at a certain level during lockdowns, like, well, I sometimes don't do anything, but and then getting back into the groove, yes, it's very frustrating to not be able to do the things that I used to do even just a few months ago. And I was going to relate to what you said, because yes, for the first, I would say, I would go like 2 to 4 weeks. You really have to like listen to what's going on inside, like to your shoulders, to your knees, to your hips, to your ankles, to like your trunk and core area. Because if you don't listen to that and start lifting up a 30-kilo weight, well, you have like a very good amount of chances that it's not going to work out anymore. You know, like you're going to injure yourself, you're going to tear something, and it's a machine. You have to like wake up, you have to oil the joints again, and then you said it's the repair, restore, refocus is a very it's a cycle on its own. It's very cyclical as well. So you'll do it for something, you're gonna like get to the next step, and then you're probably gonna have to do it again, you know, to adapt your body to that new step, and then make the changes necessary for this new step to be like to be comfortable there, and then be able to move on to the next. But you're really gonna have to listen to your body, and then feel it, not push it, and then like work as a team but with yourself, you know. And then having like an outside look as well helps, because sometimes you think you're doing it right, and then when someone looks at you, or sometimes even just looking at yourself in the mirror at the gym, you notice that something is not right, so you have to get it fixed. And that's when like either Zoltan or myself, like we come in and we're like, ooh, okay, well, I believe by doing this you'll get better, and then making you do like different things and different exercises. But yeah, you really have to take it easy. Yeah.
Arthur, have you found that at times,
take it easy?
at times on a video call, it's almost easier because you have a kind of square frame, so everything is very, you know, aligned. When you have a client in front of you, you can immediately see if an exercise is a bit skewed, which actually is different, but to, you know, if you're in a gym or you know, somewhere where there's lots of other things going on. So you know, the video call technology also has some benefits to it. Yeah,
I found it worked really well for my clients and I, because like my eyes are focused on like what the image is giving me, and then I can be like, no, like be careful of your knees now, don't let them come in, careful of the placement of your feet. And I mean, a video, like most of the time the quality is good, even if it's just okay, like I know what's going on, so it's not,
as well as how conveniently it fits into a lifestyle, right? So if you guys like, you know, certainly I'm sure if you guys have done any online stuff with people, different sessions, you know, it's amazing to think I could never have fit in this many PT sessions or conversations with people when I was having to travel to them all and whatever. And obviously there are benefits of one-to-one as well, and we are missing those. But there's also like an amazing scope for being able to actually get, you know, a session of PT into your lunch break or before work that you might not have been able to travel to, or realistically juggle into your week otherwise. So there are some benefits too. Not necessarily for you guys watching because you're all super sporty.
But that's one thing though that I've noticed with doing online sessions like via Zoom is that, or any other platform, is that people we can have our session at any time of the day, you know, like it doesn't have to be 45 minutes after work for the, like, so that gives enough time for someone to make their way from work to the gym, and if there's anything on the way they can't make it, it's just we're at home, and then you turn on your screen and there I am, or there's Zoltan, and then we like get on with the show like right away. Yeah.
So do you guys want to take the opportunity, because I mean you certainly sparked interest on more looking at the online stuff as I've been thinking about what you've been saying. Do you want to tell me a little bit about what you're offering online in terms of programs, or you know how people, the best way for people to get in touch with you, you know, to organize a program?
Sure.
Zoltan,
yeah, fantastic. Yes. So with all my clients, I think I mentioned a complimentary video consultation where we look at what's going on. You know, usually people don't get referred on to accident and emergency because they probably would have gone there anyway. But you know, sometimes there may be something going on. You may have a fracture, a Voltran fracture, or something where you need it to be seen by someone else. Other times, there are colleagues in Truth Pie who might be better placed to see you than me for whatever reason. If that video call suggests that, you know, the best way of working would be with me, then we generally look at a program of 6 sessions for anything except the simplest thing, because anything that's, you know, not extremely simple, there would have been a reason for why it happened. We mentioned ankles previously, so why did the ankle get twisted? I bet you it was already twisted at some point before, maybe even as a child, and never got rehabbed, and it's been always slightly susceptible, and so it takes a program to undo all the surrounding compensations. Joanna, you asked how to get in touch. I guess through the Truth Pie.
Yeah, you can jump onto the Truth Pie website. You can email us info@truthpie.net. Give us a call, and all the information for that is obviously on the website or on this group, or there's lots of places to find that. So yeah, just pop me a message. I mean, if you're someone watching this actually knows any of us, just pop us a message and we can always organize it all for you. Arthur, you're offering sort of weekly sessions generally, but you do more if people, you know, depending on people's goals, right?
Yeah, like I can do just weekly sessions. I don't go on a contract. Sessions are half-an-hour sessions usually, and then we'll plan 1, 2, or 3 sessions a week, and then we'll like renew that the week after. So there's no obligation. We start, and then like if we need to stop, we stop. I also offer follow-ups where I go on a monthly basis and I cover photos, progress photos, weight management, diet guidance, and I'm on your case in terms of workouts. I'll be like, have you done your workout today? Like, what time are you gonna work out? What are you gonna do? I need you to spend 300 calories, you know, and keep your heartbeat at like 150, you know. So I do that as well.
You also have qualifications in nutrition as well for fitness,
Yes.
don't you? So that's part of your programs. Yeah, research. Okay, amazing. I think that's all for today. We hope that helps you with finding some repair, restore, focusing, and that it means that you can return to sport feeling more confident, feeling stronger than ever before, and really feeling supported by others and motivated by them too. So thank you so much for joining us. Thanks, Arthur. Thanks, Zoltan,
Thanks,
for joining
Joe.
today. I'm just going to tell everyone a little bit about what's coming up. So Truth Pie have a few different events and articles and all sorts coming out this month to help you with your new year, but also really to look back at what's happened over the last year. We didn't want to go in new year, new you. We wanted to make sure that you dealt with what has happened over the last year, feel settled and comfortable going forward and confident going forward into 2021, and especially as we are still in this lockdown situation. So we have an article coming out tomorrow from Matt Fenimore regarding non-violence and non-violence to yourself, non-violence to the planet, and all of those things. It's a lovely, lovely article. So that will be released in the Time for Truth Pie Facebook group. If you're watching this anywhere else, go ahead and join the Time for Truth Pie Facebook group. It's where we put all our live events and you get all the updates. And what else are we coming up next week? We've got a video call with Liz in Trono, and we're doing a release of her. She's doing a Restore Your Balance video, which is about understanding an emotional cycle. So Liz is a biodynamic psychotherapist who does biodynamic massage and body psychotherapy and combines the both of those, and so she is an amazing expert in emotional cycles. So she's going to talk you through that and talk to you about the highs and the lows of the emotional cycle and how both of those things are really important for you in your life, so helping you to embrace the less joyful times as well. And I'm just looking whether I've missed anything else to let you know. No, that's everything. So have a lovely week, and hope you enjoy the upcoming events. Thanks so much again for joining us.
Thank you.
Bye for now.